So now we will try to talk about branches of facial nerve. So the first branch that arises from the facial nerve is from the geniculate ganglion that is located near to the first genu of the facial nerve. So this geniculate ganglion gives rise to greater superficial petrosal nerve. Okay, so this is a greater superficial petrosal nerve. Now, as we all know, the anterior wall of the medullary is also known as carotid wall because anterior to it lies the carotid artery. Okay, so this carotid artery is surrounded by a sympathetic plexus, and this sympathetic plexus gives rise to a deep petrosal nerve. This greater superficial petrosal nerve joins with the deep petrosal nerve, forming the Vidians nerve. This Vidians nerve passes through the nerve to pterygoid canal, means a canal which opens into the pterygopalatine fossa. Consider this as pterygopalatine fossa. So finally this nerve enters the pterygopalatine fossa where is located the sphenopalatine ganglion, and from here this nerve relays and gives secretomotor supply to the nasal glands, the palatine glands, and the glands in our eye. Okay, so lacrimation, palatal secretion, and nasal secretion is what is controlled by this greater superficial petrosal nerve through the secretomotor supply. Another nerve that is given is the nerve to stapedius. Okay, so this, if this is our muscle, that is stapedius muscle, this is the nerve to stapedius which controls our stapedial reflex. Okay, so the third nerve that arises from it is the chorda tympani nerve. Now this chorda tympani nerve arises about 4 to 6 mm before the exit of facial nerve from the stylomastoid foramen. Okay, so just about above it leaves the stylomastoid foramen. Chorda tympani nerve arises, and this chorda tympani nerve recurrents back within the middle ear, and then it travels forward. For clarity purpose, I am trying to draw it uh, very fade. So this chorda tympani nerve travels forward within our middle ear, and this chorda tympani nerve passes between medial to malleus, so it is easy to understand. M for malleus, M for medial to it. So the chorda tympani passes medial to malleus and lateral to incus between them, and then leaves our middle ear, passing through a foramina in the anterior wall, that is for foramina of Hagier. Okay, through foramina of Hagier it exits, and then it passes forward, and then it supplies the anterior two-third of tongue taste sensations, plus it gives the supply to the submandibular gland and the sublingual gland. Okay, so the salivary secretion through these through two glands, as well as the taste sensation through anterior two-third, is what is controlled by the chorda tympani nerve. So these were the three nerves that we need to remember mainly uh, about the facial nerve. The another branch is sensory auricular branch, which is given by vertical part, and it gives sensory supply to pinna and external auditory canal. So that part that was sensory, that is nervus intermedius or the nerve to reason, give the sensory supply to pinna as well as external auditory canal. Another motor branches are the branch to the posterior belly of digastric plus stylohyoid, and the terminating branch that gives the motor supply to all muscles of the face. Another branch here originates is to the occipital belly of occipitofrontalis. So this is what we needed to know about facial nerve, its course, its branches. Okay, thanks for watching.